What happens to my patient data? At some point in our lives, we will all be patients. But have you ever considered what happens to your patient data? The NHS has an opt-out model when it comes to data. This means that your records are collected, processed, and shared across and outside the institution, unless you confirm that you don't want to share it. To help you make decisions about your data, researchers from the University of Sheffield have investigated the values and risks of data sharing through surveys and interviews with patients and the public. They found that the majority of participants saw data sharing as crucial to improving wider public health and NHS treatment. However, there are some ethical concerns that sharing data means a lessening of patient choice and autonomy, insufficient public understanding, and risks related to data security, anonymity, and who has access. Here, we'll explain how the data information chain works so that you can feel confident that sharing your patient data is safe and beneficial not only to your health, but also to that of wider society too. The first step in the information chain is pre-processing. This happens when you visit your doctor. Information about you and your appointment is captured and organised. The second step in the chain is data processing. This is where your records are anonymised, analysed, and used in clinical decision-making to help improve treatments and save lives. Your data might also be linked up with other public sector organisations, like local councils, to further improve decision-making. Anonymised data can also be shared with private sector organisations. The third step is post-processing, where data is shared within and across organisations to tackle public health more strategically. At each data processing stage, the organisations handling your data have to satisfy rigorous security, control and storage regulations to ensure data is processed safely and only relevant organisations have access to it. So, whilst we recognise that the opt-out model does remove your autonomy as a patient, sharing your data enables the NHS and public sector organisations to learn more about health trends, make better decisions about public health, and improve treatments and patient pathways. And as we are all likely to be patients at some stage in our lives, this benefits everyone.